Well, hello everybody. We are about to begin our last subunit of Unit 1A. Again, sorry for the technical issues here. This should be the last we should have to deal with this. Alright, so this is Unit 1A.III, where we will be talking about the subfields of psychology. Now that we have explored the roots, development, and many perspectives of psychology, we will briefly go over the many subfields of psychology. Where perspectives are concerned with areas of study and inquiry, subfields of psychology are really more concerned with how we can use psychology as an occupation. What kind of jobs are out there for psychologists? For example, there are many jobs available with a psychology degree. We will explore some of those occupations and subfields further throughout this video. Typically, these subfields of psychology aim to achieve one of two purposes. One of these two purposes that some of the subfields of psychology seeks to achieve is basic research. As I said, some subfields or jobs of psychology seek only to expand the amount of information or knowledge in a given field of study. For example, collecting large amounts of ancient pottery to further support evidence of cultures from specific time periods. Our biological psychologists explore the links between the brain and the mind. Developmental psychologists study changing abilities from womb to tomb. And the cognitive psychologists study how we perceive, think, and solve problems in our mind. Personality psychologists investigate our persistent traits. Social psychologists explore how we view and affect one another. Remember, the important thing to note with basic research is its sole purpose is to increase the scientific knowledge base. Conversely, the second purpose that these subfields can serve is applied research. Applied research is research done for the sake of solving a practical, real-world problem. Like industrial organizational psychologists study and advise on behavior in the workplace, and clinical psychologists study, assess, and treat people with psychological disorders. Again, basic research seeks to expand the knowledge base of a subfield, whereas applied research seeks to solve a real-world problem. But before we explore the major subfields further, let's first explain the major differences between psychologists and psychiatrists. Take a second to pause the video and read over the bullets, but the main thing you need to know, the main difference, is that a psychologist would get a doctorate and a PhD, like a doctorate of philosophy, and they could help their patients through therapy, group therapies, things like that. Whereas psychiatrists actually are medical doctorates. They are licensed to prescribe medications. So if a patient suffers from schizophrenia, they're more likely to see a psychiatrist because the psychiatrist can actually prescribe the medications, whereas a psychologist cannot. A clinical psychologist, like the type of psychologist mentioned on the previous slide, aims to evaluate and treat mental, emotional, and behavioral disorders like OCD, schizophrenia, although remember they can't prescribe medications. Counseling psychologists help people adapt to change or make changes in their lifestyle, such as in the movie Analyze This. A developmental psychologist studies psychological development through a lifespan, which we'll discuss in Unit 5 or 6, Developmental Psychology. Engineering human factor psychologists do research on how people function best with machines, like using ATM machines or using computers, for example. How do you make them more efficient for human interaction? Educational psychologists focus on how effective teaching and learning take place. Forensic psychologists apply psychological principles to legal issues. You might have seen Criminal Minds or Law and Order SVU. Those are forensic psychologists. Health psychologists concentrate on biological, psychological, and social factors associated with health and illness, such as hospitals. Industrial organizational psychologists aim to improve productivity and the quality of work life by applying psychological principles and methods to the workplace. How to increase productivity and profits. Neuropsychologists explore the relationship between brain and nervous systems and behavior. That's my favorite unit. I can't wait for that one. Psychometricians focus on methods for acquiring and analyzing psychological data, research-based. Rehabilitation psychologists help clients with mental retardation, developmental disabilities, and disabilities resulting from neurological injury, like a stroke. Social psychologists assess and counsel students, consult with educators and parents, and perform behavioral interventions when necessary. Social psychologists focus on how a person's mental life and behavior are shaped by interactions with other people, which is our next unit, Unit 1A.B. I hope you're looking forward to it. It's a fun one. Sports psychologists help athletes refine their focus on competition goals, increase motivation, and deal with anxiety and fear of failure, like professional athletes. And this concludes our video series for Unit 1A, History and Approaches. However, we are not finished with Unit 1. We still have social psychology to go. So, I'll see you guys next time.